I am Gynecologic Oncologist. For those of you who don't understand what those two words mean, I am, let's put it simply, I'm a ladies' doctor. I'm a doctor who treats women who suffer from diseases of the reproductive tract, which means that a lot of my job involves surgically removing women's uteruses which are affected by disease. Some of the common things that I remove them for are benign tumors like fibroids, but on a more serious note, I treat women who come up with cancers which we call endometrial cancer, but for the sake of simplicity, we can call it uterine cancer or cancer of the womb. So this talk is basically a cancer doctor's viewpoint. Most of my job, before I start operating, is meeting, let's call this woman, my patient, and her family. So when they sit across the table for a consultation, literally and figuratively, there is an elephant in the room. And this talk is basically about that elephant in the room. So if you don't understand what that frame means, it's the topic we all skirt around. I'll get to it in the end. A couple of years ago, we were all battling with the massive pandemic. I'm sure all of you have forgotten almost about the COVID-19 pandemic. We took extreme measures to combat that pandemic, while silently another one was on the rise and is gripping even so-called developing nations like our own. And this is the obesity pandemic. Not much spoken for, at least in your circles, right? So this is data from something we call the National Family Health Survey that says India is a capital of obesity and is leading the world in many aspects. 1 out of 4 Indian women can be counted as being obese. 1 out of 4 Indian adult male is counted as being obese. And it's not just adults. It is said from this survey that even children under the age of 5 are now obese, at least to the extent of about 4 to 5%. This drew the attention of the medical community to such an extent that the Prime Minister of India, in his 119th episode of Man Ki Baat, raised the topic of obesity. He called upon people from all fields of life to go forward and talk about it and to bring up change in the Indian society. So, what is obesity? This is what the WHO says. The World Health Organization classifies obesity in various aspects. One is the body mass index, another one is waist circumference, and they have different numbers to codify what is being overweight, what is being obese, and what is being morbidly obese. Those are not the details I want to dwell upon. I want to dwell upon this, that if a number is called obese in your Western counterpart, that same number is stricter for us as an Indian person, which means the cutoff for obesity is much, much lower for a person of Indian origin or a South Asian origin. The reason being that if you are Indian and you're obese, it strikes you much harder because we are already genetically prone for a number of diseases, including heart attacks, strokes, and cancers, a part of which is what I treat. So it strikes us harder and it strikes us at a much younger age. As you can see that Indian kids are also being affected by it. This is a chart from the Yale University website, which lists out all the different effects of obesity on the human body, starting from head to toe. So I'll say if I am grappling with obese Indian women suffering from uterine cancer, which is directly impacted because of their obese nature. My colleague, who's a diabetic doctor, is treating scores of adults and children with diabetes. A lung doctor, which we call a pulmonologist, is treating for sleep-related problems because the obese person can't breathe well during sleep, and the list is endless. What has brought us here? That's the crux of what I want to bring your attention to. If you look at us as humans, we started at a small point somewhere in the depth of Africa. We walked across millions of miles and spread all across the globe. Today, we are talking about going to Mars and settling down. So we have always been on our feet. Today, thanks to technology, thanks to scientific advancement, we have reduced ourselves to sitting at our desk for hours together. And that's the remarkable thing that has brought us here. What has made WHO to now call out physical inactivity as a major factor that is contributing to disease in humans? This has, circling back to the woman sitting across me, this is probably the kind of woman that I meet in my clinic, and this literally, and at the cost of sounding politically incorrect, figuratively the elephant in the room. And this leads to a lot of diseases across all age groups. Ask yourself, how much time do you sit, stand, or walk each day? The Harvard Heart Health paper quotes from a survey of 55,000 people across countries who answered questions, and lists that most people sit for 7 to 8 hours a day. That's all we are doing. So now sitting is claimed as the new smoking. It kills more people than smoking does, because at least on cigarette packets, we've got warning advisory to say, if you smoke this cigarette, all these diseases. But nothing on our chairs here says that if you sit on this for this many hours, potentially you could be ruining your health. Statistics data says that sitting continuously for more than 4 hours could actually increase your chances of death by 50%. That's through your lifetime. And we are sitting for 7 to 8 hours a day. What the WHO has done is come up with a lot of different references to say how much you should sit, how much you should run, how much do you walk in a week, in a day. We have been reduced to that. From being hunter-gatherers, now we've got to have health experts advise us to say at least move 150 minutes a week. If you want to be well, go to the gym. If you want to be active, raise the bar and do 300 minutes a week. This is what this infographic says. Now, as a cancer doctor and a woman myself, an adult woman myself, what is it that I can tell you to work less but achieve more? Based on data, if you think that you've done an hour of exercise or an hour of physical training during your day, that is not enough. So, let me introduce you to something called as exercise snacks. These are not snacks you snack upon before or after you exercise. These are small bits of activity that you interrupt your entire day with. So put a timer on your watch, something like this, that says every 45 minutes you get up and walk for 5 minutes. When you interrupt your entire day with exercise snacks, 5 minutes for an hour, it beats even working out in a gym for continuously for 45 minutes and not moving the whole day. So interrupted activity through the day is much, much better than one solid hour of workout during the day. So remember to snack on exercise through the day. As much as you snack, try to see if you can introduce other ways of exercise through the day. Like, for example, schools. Maybe a teacher can take out the entire class, walk around the block, talk about geography or biology at least for a couple of classes during the day. Maybe men can take their meetings walking with headphones like this, or take their meetings standing up. So these are simple things that we can do. It was can do, but now we got to do because of the jobs that I do, and I see people suffering from the impact of obesity. For women out there, strength train. When you strength train and build your muscles, for men out there as well, even while you're sitting, your basic metabolic rate is going to use more energy, and therefore you're burning while you're sitting. So exercise snacks, walking and meeting, walking and learning, and maybe, if you can afford it, strength training. Circling back where I started, this is what has brought us here. The obesity pandemic, the obesity epidemic that is gripping our population, even here in a place like Coimbatore, in small villages around Coimbatore, the effect is tragic. When I see a young girl or an old woman come up with a disease that they consult me for, and when I see that as a healthcare provider, as a member of this society, we have not prescribed them a treatment for a disease that they didn't even know existed. Their mental eye couldn't see it, and then they've come back to me. It really hurts me immensely. So that's the disease that I feel has not been named yet. So I looked up on AI and put in physical inactivity or sedentary lifestyle, as the WHO calls it. I looked up what can you put as names for this disease that is gripping us. And this is what the AI came up with. It came up with lazy, being sloth, being motionless, being a couch potato. All of these names come up. Can I call it as a doctor? Exercise deficiency? Maybe it is vitamin E deficiency of a different kind. So I believe a name is required for this disease, because unless it's named, branded, we will not call it, and therefore we may never take action on it. So what are your ideas? Because we've got to name this disease that is gripping us.